Hi, my name is Courtney Christensen, and I sent you the email about my kids, Evan and Allie. And so I just wanted to go ahead and answer some of your questions for you. The first one, had I ever heard of Blink or used it? And actually I had not, but I just went and looked at it prior to sending you an email, and it's pretty amazing, especially since my family takes, unfortunately, a lot of medications, and I also work in a pediatric urology clinic where we prescribe a lot of medications, and actually have quite a few patients who are on Medicaid and could really use some help with prescriptions, as well as our commercial and commercial insurance kiddos too. So am I taking any prescription medications? I am. I take Lyrica twice a day, which is extremely expensive. And I also take Wellbutrin. My husband currently takes Effexor and Humira injections. Evan, as I noted in the email, takes Vyvanse for his ADHD and also does the monthly penicillin injections. So as a family, we seem to take a lot of medication. Allie is our little healthy one, and she gets by with an allergy pill here and there. Do any of us depend on the medication? I wouldn't say that any of our conditions are life-threatening, but they're definitely would affect our quality of life if we weren't able to take them. Evan will be off of his ADHD medicine over the summer and on breaks, but he really feels like he needs it at school. So actually he was the one at 10 years old who made the decision that he wanted to take medicine, and he said he feels so much better on it and is not getting in trouble for not paying attention to what the teacher's saying because he's in his own head exploring things. How do we pay for them? We actually have an HSA account that is from my job. So we are insured. We have Aetna insurance through Cook Children's. And I do carry our entire family, which is a pretty penny out of every paycheck. And then additionally, we have opted to fund our HSA to maximally fund our HSA. Actually last year though, the entire $6,000 that was in our HSA was completely wiped clean, in addition to more because of especially all of Evan's medical expenses. We talked about what I'm taking, and let's see. So my health, overall my health is good. I definitely have a few problems related to a car accident that I was in when I was 16. I've had multiple surgeries, but in terms of my heart and my lungs and all of that, I'm pretty healthy. And I will say, thank goodness, so is the rest of my family, at least my immediate family. My mom does rely on blood pressure medication and cholesterol medication and blood thinners and just a bunch of other things. So we definitely have heart disease and high cholesterol in our family, which is concerning to me as I get older, and get our yearly tests and have our children checked and stuff like that. So we talked about the meds. I've been on Lyrica since about 2014, and I've been on Wellbutrin since my daughter was born in 2010. Do I think drug prices are too high? Absolutely. I mean, obviously when generic forms come out, it makes it a lot more affordable, but it's really frustrating that for me, a medication like Lyrica, which costs about $1,200 to $1,500 for a 3-month supply, works so much better than gabapentin or Neurontin, which is significantly cheaper. And so I kind of had to make that decision about, do I struggle to pay the $1,200 for my prescription, or do I take something that's less effective? And for me, it really was a quality of life issue, and I work full time and have 2 kids, and so I opted to give up other things so that I could take the medication that was best for me. So I guess talking about prescription prices being too high, I think that ultimately we do have to make that decision. Obviously, the decision, I would expect would be less difficult if it was a condition, a life-threatening condition. And actually, to be completely honest, Evan, who gets the monthly penicillin injections, absolutely hates them. And we deal with anxiety the week before and that day, and it's terrible as a parent to watch him have to get it, but it's really imperative that he has it because his heart is at risk for infection from the strep, and so are his kidneys, and if he had not had that effusion in his hip, we probably would not have found out he had strep until he had an infection in his heart. So as much as he hates it, he has to take it. And as much as I hate paying over $200 a month for one injection, which my son despises, it is what's best for his health. And then again, deciding between your quality of life and, you know, what you can pay, and kind of weighing the pros and cons. Which person in the world is most important to you? Whose life means as much to you as your own? Oh my goodness, what a loaded question. My children, I guess. I don't know that I would be able to choose one over the other, but they are my world, my everything. And as hard as it is sometimes as a mom to make these decisions, like my son having to have these monthly injections, it's my responsibility to keep them healthy and to watch their quality of life and you know, give them the best chance possible to have a good start to life and growth and all of that good stuff. And honestly, my children's lives mean more to me than my own. I would give anything, and I tell them this all the time, if I could take that injection for my son so that he didn't have to feel it, I would do it in a heartbeat, not because I want to, but because it would make him feel better. And I also have a mom who's extremely important to me, who, like I mentioned earlier, has some significant medical problems. And I lost my dad at the age of 59 to multiple sclerosis and some complications. And so I am kind of really protective of my mom and kind of probably overbearing in terms of checking to make sure she's taking everything she's supposed to, because the thought of losing both of my parents at this stage in life is pretty scary. And then tell you a story, how you solved a health issue or problem. So I guess that's probably Evan's story that I wrote about in the email, but he is literally like a child that doesn't complain about anything. So when he complained about leg pain, I said, oh, you're probably just growing. And then the next day he was crying that he couldn't walk on it. We went to see the pediatrician, and she immediately said, Evan doesn't complain, there's definitely something wrong. You know, let's run some tests and I'll put a stat consult into orthopedics for you. And I was ready to go, thinking we had a bone problem, and I was literally like blindsided by the results that we were going to rheumatology. It was so scary for me, and trying to be strong for him and not acknowledge how scary this was, and also how to flip the idea of the strep infection, and how his body was strong, but yet he kind of fell victim to this. And so but he really bought into it, and he believed that his body was so strong that it kept the strep infection, you know, down to his joints and to his hip, and it was able to keep the strep away from his heart and his kidneys, which is really important. He does go every month, fourth Thursday of the month, to have his injection at the pediatrician's office, and like I mentioned earlier, he hates it, but he lays on the table with his phone so he can play his game. You know, we use lots of things like numbing ointment and Buzzy the little buzzing bee to try to distract from it, but he takes it like a champ, and he might tear up, but he's never screamed or cried out loud or carried on afterwards, and he is literally like the strongest little guy ever. And so we have our fingers crossed. We just hit the 1 year mark of his injection, so we have one more year. And we just hope that he doesn't contract strep again, because the idea of him having to do this every month until he's 21 is so upsetting to him and to us. And I really hope that this medication is working and we can keep him just, you know, fighting against strep at all times. And how was I strong? I guess I'm really lucky in the fact that my job is I'm a pediatric psychologist, and so my job is to help families and kids through really difficult medical decisions. And I find that I really have to monitor my own feelings and my own anxieties and really portray to my kids that everything is going to be okay, even if at the time I'm not so sure it is, or I'm scared, or I'm worried. And so I personally found strength in doing research online on, you know, the possible diagnoses, and organizing a binder that had all of his labs in it, his imaging, his doctor's notes, everything. That just gave me a sense of control. And I think that's the hardest thing when somebody you love is sick, or you're in between that period of something's wrong but you don't know what it is, just that sense of uncertainty and lack of control. And so I think that's really hard for me, but again, trying to stay positive, especially in front of him, and then not to break down until I'm behind closed doors, because obviously I did. I just didn't necessarily want him to see that side of me. So anyways, I hope I answered all of your questions. I'm more than happy to answer more, or to get you or introduce you to Evan or Allie or my husband Kyle. So thanks so much. Take care. Bye.